Hi, I'm Christy, and I'm here to tell you about an exciting neuroscience pilot project at Foothills Hospital. The NeuroFlow Collaborative has been working together since May and will be implementing changes on 4 inpatient units this fall. Before this project started, we asked our partners at FMC where we could improve. 4 themes emerged: team communication, having a clear admission criteria, developing patient-specific care pathways, and discharge planning. To address those 4 themes, the NeuroFlow Collaborative decided to develop care pathways, focusing on each of these inpatient neuro units. We've engaged with partners from the emergency department, diagnostic imaging, post-anesthetic care unit, and the intensive care unit. And we have participation from managers, nursing, physicians, allied health, and most importantly, patients. Our objective in creating care pathways for these patients is to provide efficient and high-quality care to reduce prolonged stays, improve consistency in the care we provide, enhance access to specialized services, address capacity issues, and, ultimately, lower costs for everyone. But importantly, we will also improve the quality of care that patients are receiving and that our team is providing. Let me show you an example. Mr. Jones is transported by EMS to Foothills Hospital after falling ill at work and is ultimately diagnosed with a brain tumor, which requires urgent surgery the next day. The following morning, Mr. Jones is moved from ER to surgery and then on to Unit 112 for recovery, and he's ready to go home 5 days later. Unfortunately, while Mr. Jones is ready to leave Unit 112, his family is not ready to care for him at home, and there's no discharge plan in place. 7 days after his admission, he's still in hospital. Our care pathway has a bit of a problem, doesn't it? To address this problem and achieve our goals, we've been measuring things like delays in transfers, patient satisfaction, and input from all healthcare providers. These factors help us understand things that keep our patients in hospital longer than we expect. And critically, we're also ensuring a care pathway is started for each of these patients on admission. Here's what we believe is a better patient flow plan for our scenario. After the 911 call at Mr. Jones's work, he's taken by EMS to Foothills Emergency Department, where, as part of his diagnosis, a care pathway is implemented. The care pathway allows for greater consistency of care between different professionals, provides a better overview for patients and families, and increases the opportunity for patient empowerment. In other words, the care pathway helps patients and teams to understand and anticipate the next steps on their journey, have expectations on when services should be scheduled and accessed, and be prepared for what they will achieve on their journey toward home. After being assessed by an appropriate neurosurgeon on day 1 and having a discussion about the plan of care, Mr. Jones receives imaging, is admitted to the right unit, depending on the care he needs, and has his surgery scheduled for day 2. After surgery, he's transferred to the most suitable inpatient neuro unit for recovery and rehabilitation before discharge to his family, who are now prepared for his ongoing recuperation at home. He also leaves the hospital with his next outpatient appointment already scheduled. We believe the NeuroFlow Collaborative will lead to more resources available for patients when they need them, fewer delays within hospital and on discharge, and improved patient satisfaction. But we'd like to hear from you. Let us know if you have ideas or want more information about the NeuroFlow Collaborative. You can find us at dcns.ca/NeuroFlow. Thanks for watching.